Good afternoon, everybody that entered. We are just about a minute shy of the start time. We'll give people a couple minutes. There is a number of people that registered for the webinar. I just want to make sure everyone has the opportunity to arrive. So I might give everybody another 2 minutes and then we'll get started. All right. Well, I know everybody has probably a busy afternoon, so we can go ahead and get going. I thought I'd start today's webinar by just introducing myself. For those of you who may not know who I am, as well as IMC and a short history of what we do. So my name is Scott Eiselt. I'm a physical therapist by trade and serve as IMC's VP of Clinical Operations. So that's overseeing our quality, some of our clinical programming and vendor relations. And then I also serve as a clinician within the organization as well. I've been with IMC now going on 13 years. And so today we're going to present a little bit about what we do, but IMC stands for Integrated Musculoskeletal Care, for those of you who may not be aware. And we are a musculoskeletal care delivery company. And we specialize in the assessment and care of spinal problems, joint issues, muscle or nerve problems that individuals may have, focusing primarily on whether or not someone has a problem that can resolve with movement-based care. And if they can, we can often take them from start to finish, resolve their problem, or helping them, if they cannot resolve movement-based care, down a appropriate pathway for treatment with another discipline if necessary. Part of what we focus on is not only treating someone's problem in the that they're potentially living with in the moment, but then also helping them recognize how to care for that problem ongoing, which is self-care and prevention techniques. So we're going to focus on some of that today, but also what to do if a problem does arise, but specifically around our cervical spine or our neck. Just briefly, we're going to talk facts about neck pain, common causes, maybe myths or misunderstandings around neck pain or things that we do when we have neck pain. Briefly talk about the mechanics of our neck, how it works, why it's needed to work that way, and what happens when things aren't working properly. And then we're going to dive into some self-care and prevention techniques that we can begin to implement and utilize very simply on our own that help lower and reduce our risk for an issue going forward, but also help us recognize if a problem is going to arise and what to do from an action perspective. Okay. And then lastly, we're going to touch briefly on the different modes of care that IMC is capable of delivering to you as an individual or to anybody that potentially works with you, depending on who you work for. And then we'll leave a short amount of time at the end for questions if they do arise, given the topics. I think there's also a message board, so feel free to shoot something on there. My colleague Nick Bellis here helping me as well, so he can bring those up if that happens. So without further ado, we'll kind of jump right in. So neck pain is a very common condition. Our company keeps a lot of internal data around prevalence and incidence of various joints and within a population that we see, or joint problems, I should say. And neck pain is typically the second or third most common reason somebody presents to care with us. And so very common, it's very recurrent in nature as well. And some thoughts about it are, from an age perspective, really they can come in any and all ages. People can have neck pain or neck impairment as little as infants, although not very common, but also is well into our geriatric years as we get older. So age is not necessarily a primary determinant of impairment, nor does it influence whether or not somebody can resolve a problem or manage a problem. It can be a factor in some cases, but it should not be an excuse as to why we have neck pain or a reason as to why we haven't responded, unless that's proven through assessment and care. As far as kind of buzzwords you'll see if you were to search neck pain, degenerative arthritis is a very common diagnosis that is given out at this point. A number of reasons for that. You can't watch a television show or a game without seeing a commercial about maybe arthritic medicines that we can take or apply to ourselves. But as we get older, degenerative changes within our joint, which is the kind of wearing down of our joints, is a natural aging process. Okay, many call it gray hair of the spine, if you will. And so it's a very common, if not presentation on imaging. So if someone were to have an x-ray, nearly all people over the age of 50 are going to present with some level of arthritic change within their joints. Okay, so that's not to say it can't cause pain, but because it's present in so many individuals without pain, it's oftentimes a kind of presenting factor, but not necessarily the reason as to why the problem is there in the first place. I just touched on imaging. Imaging is a very useful tool in certain circumstances where someone is having maybe the severity of the problem, or they're deteriorating from a condition perspective, or there's other things that are potentially sinister or concerning. Imaging has a place, but often it's overutilized in terms of the frontline assessment and attempting to identify a root cause of the problem. And it's not useful in the management of most conditions. Part of the reason is what I mentioned about arthritis. Very common that we see structural problems on imaging, whether that be an MRI or an X-ray, and we need to make sure that we provide treatment to somebody based on how their anatomy behaves. So how does someone's neck problem behave when we move it around or in their daily life, not based on what it looks like when we take a picture of it not moving. If the two match, your behavior of your neck problem when we move it and assess it and test it matches what we see on the image, oftentimes then treatment can be streamlined, and in that particular instance, it's very useful. But it should not necessarily be used as in the first couple of weeks. It's more appropriate to attempt to resolve your problem through conservative means. Inflammation, another buzzword, again, very common in commercials or walking through the grocery store or the pharmacy. Inflammation can be a cause of pain. It is a healthy reaction from the body when we have an injury or the body needs to heal itself. However, it is only the root cause of pain when it comes to musculoskeletal problems in about 2 to 3% of cases. So do anti-inflammatories help us when we're hurting? They absolutely do, but they often don't resolve problems when they arise. Okay, anti-inflammatories are a tool to maybe manage symptoms, or if the problem appears to be inflamed and we can't then resolve it, then they're helpful. But again, it's not often the root cause. Okay, one way I look at this: if you have a splinter in your finger, it gets puffy and red around it. Well, that's the inflammatory response your body is using to attack that splinter, to try to get rid of it. And if you pick at that splinter and you can't get it out because of the inflammation, you need to let it settle down sometimes. But ultimately, that inflammatory response won't fully go away, nor will the problem, until we get the splinter out of our finger. And that's much like our joint problems, in that we have to mechanically correct the problem or the inflammation will continue to be present, but it's not the cause. As far as what is often the cause, underlying a lot of what our mechanical problems or musculoskeletal problems are how we use our joints. So we function in a very repetitive manner. We put ourselves in very repetitive or prolonged positions that are the same day in and day out. And this uses the joint in one particular way and puts a lot of stress on one part of the joint, while another part of the joint is not being utilized. And this can cause a disparity of movement, and therefore we can start to then have problems within how the joint works, and we'll jump into that in a little bit. Majority of neck pain, our internal data suggests between 90 and 91% of cervical spine problems are actually rapidly changeable and reversible in nature. And so I'm sure those of you that are attending, many of you have had a crick in the neck, you slept wrong. Well, you didn't have a violent sleep, or you didn't undergo some major injury, but something may have changed within the way that your cervical spine works while you were sleeping. And it often wasn't that night, but the cumulative effect of our lifestyle, and then something changed in that moment. And that's a very reversible condition. It rapidly changed in the first place, and often it can rapidly change for the better. You just have to know what strategies to start to utilize. Okay. And lastly, because of that rapid changeability, these problems that can correct themselves with movement can also be prevented with movement, or at the very least, we can recognize when one is about to occur if we know what to look for. Okay. So hopefully that kind of frames the kind of landscape when it comes to neck pain. As far as our mechanics, how our neck works, I won't spend too much time here. This is not an anatomy lesson by any means, but essentially you have a joint in your neck is made up of two vertebrae, okay? And they sandwich a soft tissue disc in between the two. And within that disc, there is a series of kind of little pieces of material, if you will, that's called the nucleus, and they function like ball bearings in between the joints, okay? And those vertebrae, as well as that disc and other materials in there, they all need to be in the correct position, similar to a puzzle. And each piece of that puzzle needs to be in the right position for you to view the puzzle, for it to work properly. Very, very similar to the way our neck works. If all those pieces of the puzzle or of the joint are where they are supposed to be, your neck is going to work properly and it's going to feel normal. But if something starts to move slightly out of position or undue stress is put on it, it may start to then cause pain or stiffness or impairment in some way. I mentioned earlier, repetitive movements and prolonged positions are a factor, and probably more now than ever. You know, we have sedentary jobs, or those of us that may work in an active environment, whether that be like a manufacturing line or something of that nature, you still are often finding yourself looking down, okay, or looking forward. And much of our life is in front of us and below us. As a result, we find ourselves in the positions like these two individuals, where our phones are a very strong factor, our windshield, our computers, or even how we sit on the couch. We think we're looking straight at a TV, but we're still in kind of that head down or head forward position. So this constant movement in one direction starts to take those joint pieces I talked to you about as far as the puzzle is concerned, and starts to move them potentially in positions too much in one way, so they move out of their normal resting position, and this can start to cause impairment within the joint and how it functions. So what can we do about that? One of the main things we can do is change our posture. This can be sitting or standing, for instance. So if you sit for work, if you look at the first person on this slide, she's sitting, but her low back has a rounded, she's lost the arch in her lower back, which is a natural position we should have. It should be arched. Well, because she's lost that, if she doesn't, that then causes her shoulders to roll forward, her upper back to roll forward, and she would be looking down if she wasn't then pushing her head up and forward as well. Okay, so this is a very common position we all tend to adopt. The correction, a lot of people in the clinic, when you say, hey, go ahead and correct your posture, they'll often pull their shoulders back. And although this can help to some degree, the correction needs to occur at our base, in our foundation. As you can see in the middle picture, she has now put an arch in her lower back, which has then caused her spine to then straighten up all the way to the top of her head. This is the normal resting position, and now she has the normal curvature put back in her spine, starting with her lower back, which is where we need to start from a posture correction. Now, it's great if you can get in this position, but many of us cannot sustain this position for a long period of time. So as a result, over time, we'll fatigue, or our attention will be drawn elsewhere, whether we're in school or we're at our computer or in our car. And so we start to then flip back to that first picture. And so one of the tools we can use is using some type of lumbar support. So in the third picture, you'll see a pillow has been placed where her hips are under the pillow and that pillow is helping to maintain that low back support. Many of us have office chairs that have built-in low back support. We just don't use them properly. So pushing your hips and your tailbone to the very back of that chair and letting it support the normal curves of your spine can be a great starting point. Same goes for your car if that's the case. If you work in a standing position, I don't have it on the slide, but think about whatever it is you're looking at or needing to be attentive to and the location of it. So if you're working a standing desk and say, well, this doesn't apply to me, it does if your computer screen, if you will, is below you, because you're still going to be in that downward looking position. So trying to get things up at eye level can assist in taking some of the pressure and stress off the back of your neck. So that's probably step one. If someone said, hey, what can I do to prevent neck pain? That'd be the number one thing I would recommend someone do is start to then put in place mechanisms to support and control your posture. The second thing we do is we can start to apply movement. I mentioned earlier that looking down causes a change in position within the joint. And often that's because we move in one direction only. So the things within the joint start to accumulate where we don't move. Where we don't move is we often don't move backwards and up. And so as a result, we lose that mobility and the joint starts to then malfunction. Okay. So I'm going to play this video while we talk so you can kind of see the nature of that. So what this individual does, she's sitting to the very back of the chair. So while you're listening, feel free to do this. She's pulling her head straight back over her shoulders, okay? Like someone said something you didn't appreciate. And then once you get there, you take and you look up and back over the surface of a chair, if you have one, as far as you can possibly go. Right? By moving in this direction to its very limit, you keep the joints healthy towards the back of the joint, given how much we move in the other direction, and it offsets. The other valuable tool in this circumstance, I'll play it one more time, is that this is often one of the first movements that starts to become stiff and uncomfortable when we have an underlying neck problem that is either in the background and we're not addressing it, but it's not a problem yet, but it could become one, or one that's about to start. Okay. And so doing this movement on a regular basis starts to set a baseline for us. We can start to recognize what our normal movement capabilities are, so that on a day when you go to do it, you find, wow, that's really difficult today compared to normal. If we never do it, we don't know what that normal is. And so if you recognize there's something that's changed, that can be then an actionable time where then now you can start to then do this movement more often. I'll give you a couple of things you can work on in order to start to correct that stiffness, because you're recognizing something in our body has changed. Okay. So obviously the main topic today is prevention and self-care. So the daily self-assessment we just touched on. So starting to do that movement on a regular basis, many of us don't do it. And unless you do what I do for a living, or maybe you cut trees or you're looking up all the time, but starting to do that on a regular basis, just to become familiar with what your normal is. All right. And if you do that and you're going to want to do that repetitively, so do anywhere from 8 to 10 repetitions so that you kind of learn, you'll loosen up as you go. I was like, okay, now I know what my normal is. And then each day you continue to do that, looking for stiffness or pain that wasn't there the day before. Okay. So prevention is that, we recommend somewhere between 8 to 10 reps 2 times a day. And quite frankly, if that seems too daunting, I would recommend then even just a well-placed 1 or 2 repetitions sporadically through your day can be just as effective, right? Offloading or moving away from what you've been doing. It can serve as a balance point, if you will, to the movements we're often finding ourselves in. Okay, this allows us to maintain a healthy joint, but then identify problems that may be starting to arise. Now, if you do find that that movement is stiff or painful, and it typically is not, often then if you start to do that movement anywhere from 4 to 5 times a day, that will start to resolve fairly rapidly. Within a matter of a few days, that will normalize itself. Right. So if it's not a problem now, but let's say in 6 weeks you go to do that, and you're like, wow, that's a really stiff and painful movement today. Start doing sets of say 8 to 10 of those. Do that every 2 to 3 hours, which would be about 4 to 5 times a day. And you should start to notice that that's getting easier and easier. And over the course of a few days, you'll then drift back to your normal. If for some reason it doesn't, or it worsens, remember this movement is intended to be an indicator of a problem or a corrector of a problem and a preventer of one. Well, in some cases, it doesn't correct it. It's just indicating a problem, and we need an alternative movement strategy. And that's where utilizing a few different parts of our care process would be of benefit to you. So this is a great jumping off point, even if it isn't corrective in nature. But for someone who's dealing with a neck problem, if you try this movement and it isn't corrective, I urge you to make sure you take the next step. Don't assume that movement-based care is not an appropriate care pathway for you. In fact, it likely is, and this movement served as the indicator such that you need to then seek care through an appropriate clinician. One of the ways, so there's 3 ways that you can utilize our services beyond the preventative movements that I just went through with you for the neck. We have a web application, so it's called Joint Strong. And within this web app, you can go through any joint in the body, and you can then find educational tools, movement principles, movement ideas to help improve the health of that joint, but also then recognize problems. If you're having a current problem, it can take you through a self-assessment, and it'll ask you questions to kind of guide you down as though it's like an automated clinician, if you will. And then you would give it feedback. And based on the feedback you give it from the activities or exercise or movements it has you do, it will then set up a treatment plan for you and walk you through that to help you self-resolve your problem. Or you might indicate through the self-testing that you're a better candidate for clinical care or clinician-based care. And it would then trigger you to contact us to set up an assessment in order to determine what is a more appropriate care pathway for you. Okay. And we can do this through, we have 2 different means. We have in-person care at many locations throughout the United States. So depending on your employer and our relationship with your employer, we may have a clinic in your area. And if so, that would be an option available to you. And so you can call the number on the screen here. Or if you are not in one of those locations, or that's not the arrangement that we have a large virtual care network. So we're in 49 states, and we provide care through telehealth or kind of FaceTime-based care pathway. All right. And so for those of you, I want to touch on this a little bit. Oftentimes, this gets an initial reaction from folks that, I don't know, I don't know how you're going to fix my neck problem, for instance, if you're not in the same room as me. When in fact, overwhelmingly, close to 90% of all cases, we don't have to put our hands on someone. We can teach that person how to appropriately move and accomplish the same things we would if they were in a clinic with us. And if there are strategies that we would typically use with our hands on or in the clinic, we can be creative with the environment we have. And then in some circumstances, we have to then suggest an in-clinic, but that's a very rare occurrence. So outcomes are very comparable. It's an extremely convenient option for many of us who may not be able to then carve out a large portion of our day to go into a clinic if we don't have it near us, but then you can do it in the comfort of your home or your office or wherever you are. So that's a very, very good option for you, depending on what your coverage is. All right, so that was I think that left us right about 20-25 minutes. So it leaves us about 5 to 7 minutes for questions here. So I'll pause and just kind of leave the line open. If anybody wants to throw out a question, feel free.
Can you please share this PowerPoint to us?
Yeah, so we're doing a recording. Nick, maybe you can comment on how they can access this after the fact.
Yes. So as far as the recording goes, you should be able to access the recording through Teams. So if you want to go back and watch it, Teams should send you a summary of the recording to be able to view. And then as far as the PowerPoint itself, I will go ahead and get that from Scott and then send that out through Teams after the fact as well.
Thank you.
Yeah, no problem.
Is there a cost for the Joint Strong app? And I'm looking in the App Store right now for Apple, and I having trouble finding it.
Yeah, apologies, it wasn't on the slide. So it's not an app, like an application within the App Store. It's a web app, so you can access it through either a desktop or a tablet or smartphone. And there is no cost to go in and utilize the app piece. Nick, do you want to just give them the web app address?
Yeah, so the app address is app.jointstrong.com, and you can go there and sign up to create an account. And then once you select your employer, you'll be able to finish the account, and there won't be any cost to use the app.
Okay, thank you.
And I can go ahead and put that in the chat as well so that everyone has it.
And then I'll edit this slide, and apologies on the oversight there, so that when that gets sent out, we can put that on the web application slide for people.
And Scott, there was one other question in the chat. It was around recommendations on a chiropractor. So I can answer that one real quick. So IMC does have both physical therapists as well as chiropractors available. So depending on the employer that you work for and the location that you're at, you may have a chiropractor through IMC that's located near you, which you can, for almost all of IMC's employers, receive at either reduced cost or no cost. And so with that, the best way would be to contact our care coordination team, which I can put that number in the chat as well. And then you can find out if IMC has a chiropractor or a physical therapist that's located near you.
And then as far if the question was geared towards, what about utilizing a chiropractor for, neck pain or that sort of thing? Chiropractors are doing what I would consider mechanical care to some degree. They're just applying care to you through adjustments or manipulation and other forms of advice. Often this is helpful to many individuals. However, it tends to be a more dependent strategy in that it's doing the care to someone, which then isn't teaching self-care principles like I touched on in the beginning. So you're not necessarily in those circumstances often going to learn, if you're going to a chiropractor to be adjusted or manipulated, how do I do this to myself, which is a main facet of our kind of mode of care. So hopefully that touches on. If you need more further clarification, feel free to type another question in the chat or speak up.
And Scott, looks like there is another question in the chat around any corollary or connection with diet/nutrition or weight management and MSK outcomes.
Yeah, it's kind of an emerging topic, and it's a hot topic right now, depending on your podcast circuit and what you listen here to. So, literature and especially newer research does suggest there is a connection between some of our diet, our lifestyle, maybe other diagnoses we may have, whether that be diabetes or other conditions, and how they influence our musculoskeletal health. However, they're often a factor in terms of our rate of healing, maybe how we feel, and they're a layer as opposed to the root cause. All right. And so if they're the root cause or they're becoming a barrier to our recovery, that can often be identified, in that you won't then be an individual when we assess and care for that you're not making steady progress, and those things then become something we would consider. But to answer the question in short, yes, they can be a factor. In some rare occasions, they can be the root cause, and that would fall into that like 2 to 3% of cases where maybe there's an inflammatory component or other health comorbid components that we can't necessarily address with movement, and they're getting in the way of your care. So hopefully that answers what your thought there.
Great. Well, that looks like all of the questions in the chat, Scott.
Great. Well, those of you who did attend today, thank you very much. Feel free to reach out. Like Nick's put the web application address up on the chat itself, or in Teams chat, and then we'll send out the recording here in the next day or so. But thanks again for attending, everybody. Have a great rest of your day.
Thank you.
Thank
You
you.
too.